Hello, and welcome to an episode of Aaron Snee's Podcast, the podcast that's had about 10 names in the past few weeks, but I'm keeping it self-titled, so don't change my name again. This is just a quick educational podcast aimed at women going through menopause and how to set up their nutrition, things to look for, specific health issues to look for as well, and how nutrition could play a role in helping you deal with the issues that come with menopause. Nutrition isn't a replacement. You can't sort of holistically fix the hormonal issues that's going on with menopause. You can't fix them with nutrition, but lifestyle intervention will make you feel a million times better, and some of the health associated risks with menopause could only be mitigated by exercise and nutrition, really. Medication to a point, supplements to a point, but without good nutrition and exercise, you'll make your whole situation a hell of a lot worse. So I'll try and keep it brief, and I'll try and keep it without a lot of science jargon. So actually my screen's disappeared. Give me a second. Right, so segment one. What happens during the menopause? Before we sort of go into things you can do, where to start with your nutrition and exercise to kind of make yourself feel better, we'll look at what actually happens. I was on a full day seminar as part of my nutrition degree and part of my continued professional development. So a full day seminar, it was actually over 2 days a few months back, about menopause, and it was really interesting. One of the reasons I even went and studied nutrition was because I'm fascinated by the link between diet and disease, and more so the diet, the lifestyle induced diseases that can come on as we age, things like diabetes, heart disease, things like that are preventable to a point with good lifestyle, nutrition, or at least you could slow it down anyway. So one of the main things that happens in women's life as they age is menopause. So that's kind of one of the aspects that I've been really interested in learning about as well. So before we go into some of the things you could do to prevent it, we'll talk about what's going on in the body. So when women approach menopause, it's usually in their 40s, maybe as late as 50s, sometimes earlier. There's a natural decline in hormones, estrogen, progesterone, things like that. And these are key players in all sorts of stuff: hormones, glucose metabolism, bone health, skin elasticity, sleep, mood regulation, and stress management. So basically, when you hit perimenopause and onwards, so much changes in your body. So as these hormones decline, a few things happen. Your metabolism starts to slow down. On that seminar, it says that your metabolic rate slows by around 150 to 200 calories per day, which is a lot, especially if you're a small female. So the days of dieting on very low calories are probably done for you, because if you felt terrible in the past doing that and you've got a slower metabolic rate now, you're just going to feel even worse and slow your metabolism down even more. So metabolism slows down. Fat distribution shifts because of the hormonal changes in your body. Fat distribution shifts, and it'll be more around the abdomen. That's a sign of insulin resistance as well. But also in menopause, that's the next thing I was going to go on. Insulin resistance increases. Now, when you are in an insulin resistant state, you're basically in a pre-diabetic state. But just by default, all the hormonal changes in your body, you become insulin resistant as well. And thyroid function can decline as well, because estrogen is a main player in thyroid health. and thyroid binding proteins can increase, making thyroid function less efficient. This can lead to fatigue, weight gain, and depression, etc. Your sleep quality declines as well. Now, this again is due to hormonal dysregulation, and the drop in estrogen causes fluctuations in cortisol, which is the body's stress hormones, and it just plays havoc with your sleep. But there is good news. Obviously, the first protocol is HRT. I'm going to touch on that. I'm going to touch on sort of blood work as well. I've also written a case study. It's a fictional case study, but it is some of the symptoms that some of my clients have had, and I've just kind of made up a fictional character. But I'll send you that as well. If you'd like, just drop me a message and I'll send you that to read through, and it'll kind of maybe make a bit more sense than me just sort of speaking through all the symptoms and how to address them if it's in front of you. I've sort of listed through symptoms and things you can do and why it helps right through the case study sort of thing. So before, like, people are obsessed with crash dieting, and that happens, men and women are obsessed with crash dieting, obsessed with getting in shape quick and then thinking they could stop getting in shape once they're in shape, but then you just pile the weight back on. Now, when you're young, you kind of get away with that. But as you start to get older and all these hormonal things changes and your lifestyle changes as well, you've normally got more stress to think about, to deal with that anyway, just as you get older. When you add on all the stress from the change in the hormones and things as well, when you add in a severely low-calorie diet like that, or severe exercise where you're burning a ton of calories all the time, you're just adding stress to an already stressed situation, and the only outcome is burnout and feeling even worse. You simply won't get away with it. It's not even a maybe you'll get away with it, it's you won't get away with it. So phase one, before you even think about fat loss, is making yourself feel better. Is it building a strong foundation of you feeling healthier and feeling energy and improving your sleep. Now, that might mean HRT as well as lifestyle factors as well. It's probably going to be like what they call multifactorial. You'll probably hit factor in a lot of different things. But that should be your first protocol. Even if you do have a lot of weight to lose, I would put it on a shelf and I would focus on feeling better. The minute you start feeling better anyway, you'll automatically become slightly more active in things. That's called NEAT. Automatically, your body will just do it subconsciously and you won't even recognise you're doing it. And that in turn will probably drive a bit of weight loss anyway during these initial phases when I'm saying build a strong foundation before you think about an actual diet, a fat loss phase. During that building the foundation phase, the health phase, if you like, you possibly will lose weight anyway. You probably will. But so initial assessment is obviously medical. It's obviously medical. Is go and get blood work done, and if possible, get on HRT as quick as possible, because anybody that's selling you natural remedies for this is a snake oil salesman, a charlatan. There's no way of treating this without HRT, without hormones. There's no way of balancing out the hormones as we age, unfortunately. So initial assessment, get blood work done, and obviously consult with a doctor for that, for HRT and things. But also you want to be looking at your thyroid hormone panels as well, to make sure your thyroid health isn't decreasing. You're still producing enough T3 and T4. And you would, if you were working with me, I would tell you to go and see your doctor about all that as well, and then I could even look at your bloods for your thyroid and things as well. But we would look at blood work, sleep quality, stress levels, and body composition, and we would try and improve each of the areas with targeted nutrition, exercise, and medical help with HRT or whatever. So yeah, we need to check stress levels and sleep patterns as well, because they could both drastically impact how you feel and how your body responds to training and nutrition. So Nutrition, the absolute most important thing for everybody, but especially in phases like this of your life, is to preserve muscle tissue. Now, when people think here gaining muscle or preserving muscle, they automatically start to think of athletic physiques, bodybuilders or whatever. But everybody's got muscle tissue on them, and everybody needs to keep it, because your muscle tissue has a direct influence on how your body processes foods and how your metabolism works. I mentioned insulin resistance. When people become insulin resistant, that basically is your body struggling to deliver glucose to your muscles and liver cells and stuff. It struggles to get blood sugar, so blood glucose, into the cell. That's what insulin resistance basically is. Now, when you strength train, so when you lift weights, you create something called, that you've got inside your cells, you've got something called glucose transporters, GLUT4 being the main one that pulls glucose into the cell. You activate that during exercise, basically. So afterwards, your body could process carbohydrates better, so it could balance your blood sugars much better if you strength train, add in some weight training to your life, to your overall life. It doesn't have to be a lot, but you will literally keep yourself younger and healthier, and a healthier metabolism. High protein diet, obviously I'd aim for 1.2 grams per pound of weight. But as I say, because estrogen drops and your hormones drop, then it puts you in prime position for a lot of metabolic issues. And if you lose muscle on any kind of diets as well, it just makes the situation worse. So protein, high protein diet, strategic carb timing. So this is where, whenever people mention insulin resistance, the automatic go-to is to remove all carbohydrates. I just touched on exercise making you insulin sensitive there, because it pulls glucose into the muscle after training. So the way to approach it is to strategically place carbohydrates around your exercise sessions, or earlier in the day when you're going to be more active, and maybe have higher protein and higher fats in the evening. Again, it's on a person-to-person basis, but these are just general guidelines. You don't have to be scared of carbohydrates. Dropping all the carbohydrates out your diet without knowing what you're doing will 100% backfire. Your mood will drop, your energy will drop, your sleep issues will get worse. You'll 100% make yourself worse, unless you know what you're doing properly. Keto diets can work, but they're really hard to get right, and they're really hard to stick to, because everybody likes to eat out and things as well. So when it comes to nutrition as well, getting a lot of micronutrients into your diet is extremely important as well. Omega-3 fatty acids, they reduce inflammation in your body and things. Magnesium, nobody gets enough magnesium. Vitamin D, calcium, things like that. Instead of thinking about calories, there's an over sort of emphasis on calories these days. Everybody should be focusing on nutrition as a whole, but especially in periods like menopause and things like that, it becomes extra important to focus on the details, focus on the nutrition you're putting in your body. Because you will feel better, your body will run better, and when your body runs better, it'll burn fat more efficiently, and you'll lose weight easier when you do go into a calorie deficit. You want your body to be running as efficiently as possible at all times, especially when you're going through something like this. So, exercise as well. A lot of people I've trained in the past, especially in this sort of age group, I think lifting weights is becoming more popular in the younger females, maybe 30, mid-30s and down. But sort of people in their 40s and 50s, some people still have the sort of old school view on strength training and don't really feel right lifting weights. But a lot of the times they're right into high intensity sort of Metcon, CrossFit style stuff, or like the boot camp style classes that I used to run in the morning and things like that. Now, that's all fine and well for helping you get fit in that, but the amount of stress you will drive through constant high intensity sessions. So these high intensity sessions throughout the week, if you're doing a few of them, will burn a lot of calories. And then if you pair that up with a low calorie diet, then add the stress from work, stress from life, and then the extra stress because your hormones are all over the place, it is a recipe for constant burnout. If you like that style of exercise, add it in maybe once a week, but in the beginning I would pull it all out. I would get rid of it all, and I would lift weights, strength train 1 or 2, 3 times a week, and I would walk, do some yoga, do some breath work, get your stress levels down, and eat a lot of food for the first wee while, and try and get your sleep better, your mood better, you're feeling better, and you're feeling calmer as well, less stressed. And then once you are at that point where you're starting to improve all these markers, then we can think about, right, it's time to actually focus on fat loss as well. So yeah, sleep and stress management, kind of just touched on it there, but sleep is a big issue. Establishing good sleep hygiene, like having consistent sleep schedule, go to bed at the same time, go up at the same time, reducing screen time before bed, so no phones, no blue light before bed, and obviously helping to optimise your hormonal function. So HRT, again, will help this a lot. And muscle recovery, making sure, as I just said, making sure you're not too burnt out from a lot of high intensity exercise, because that will just affects your sleep anyway when you start to feel a bit overtrained. So if you've got poor sleep, then you make it worse with undereating and overtraining, and then you've got stress, and as I say, it just becomes a melting pot of so many different factors. So then once you are feeling better, if you focus on them, so focus on getting your sleep a bit better, eating a lot of nutritious food, healthy nutritious food, cleaning your diet up, viewing nutrition as nutrition instead of just calories like a bank account. Focus on food quality, focus on getting a lot of vitamins and minerals and things in your diet. Start tackling your sleep, start tackling your stress. Once you start to feel a bit better, replace any high intensity exercise with lifting weights one day, a couple of times a week, and stuff like yoga, deep breathing, walking, stuff that's going to calm your nervous system and get on top of the stress. Once you start to get in that position, and ideally are on HRT and everything's starting to stabilise, then you can think about fat loss. Then, still, even though you've started to correct all that, or at least work on it, massive calorie deficits will still be detrimental. So start off by a small calorie deficit, sort of 10 to 15% below maintenance. So, for example, a 100-pound female would need, and nobody weighs 100 pounds. That's like extremely like light anorexic. It's just easy maths for me. So a 100-pound female will need about 1,500 calories to maintain that 100 pounds, yeah. Everybody undereats massively. Everybody undereats. So a 10% deficit is probably still somewhere 1,700 calories for most people. And take the slow approach. Focus on constantly feeling better instead of burnt out. And just by default, just by doing that, you will automatically become more active. You'll be healthier, you'll be less stressed, your body will run better because the nutrients going in. Because you've got more energy, you will automatically do more stuff and things, and it just creates a better environment for you to not just lose the weight, but you'll feel good in the process. It will take longer, but you will feel good in the process instead of trying to do an extreme crash diet that you will not be able to complete and putting yourself through hell in the process, and then at the end of it going, fuck this, and putting all the weight back on again because you've just, and again, that's the cycle that people are caught in life in general anyway, but it just makes it even more important with all the hormonal changes and all the lifestyle changes, all the physiological changes that's going on in your body during this time of life. It makes it more important to really focus on doing things the right way for once as a lifestyle instead of a quick win, a quick diet, because they almost always backfire. So fat loss while preserving muscle. As we go through the fat loss phase, you would start on like a 10% deficit, and we would just tweak things as we went. That's what I do with everybody anyway. Maybe you would get about 6 weeks of fat loss out before we had to look at your calories. Then we could maybe increase your walking and then pull your calories down a bit. We would do it in steps. Maybe first we would increase the walk-in, get another couple of weeks of weight loss, and then pull your calories down. When you get stuck again, pull your calories down by another 5%. So it's all done in like incremental steps. And then if you've got a lot of body fat to lose, for every 10% of your body weight lost, so again, easy maths, like we'll use 200 pounds for example. If you lost 20 pounds off the 200 pounds, once that 20 pounds is lost, we would go into a maintenance phase, because the same applies as crash dieting. If you've got a lot of weight to lose, it takes time, and if you keep pushing it, it will backfire. You'll get to a point where you can't lose anymore, and your energy levels have plummeted because you've dieted yourself into that point. You've no choice but to keep pulling your calories lower and lower and lower. I've actually just done it. I had like 6 months there of successful dieting, probably the best dieting I've done for years. And then I had 6 months, I'd went from 15 stone 10 to 13 stone 4. Things slowed down. I should have went, right, enough's enough. Things have slowed down. I'll maintain for a bit. But me being me, I kept pushing and pushing and pushing. The result being that I've had to pull the plug and gain a stone just to start feeling better again. So I'm now going to have to lose that and then try and get further on. Practice what you preach, yeah. So the right way to do it is to have diet breaks scheduled in, is to have periods of maintenance. And the periods of maintenance allow you to focus on maintaining your new low weight anyway, because the calories you need to maintain a weight are different from the calories that you need to lose a weight. I hate speaking in terms of calories because I'm trying to get people think about nutrition as a bigger picture, but calories, when it comes to energy in and energy out, calories is language that people understand. So for example, if you weighed 100 pounds, which nobody does, a calorie deficit for that woman would probably be around 1,200 calories, but maintenance would be sort of 1,500. And that's what people can't get their head around. They could eat more and still stay at that low weight. And again, that's another factor that drives the whole yo-yo dieting thing, because people they're scared to eat again because they're going to regain. And then it gets to the point where their body just goes, you're eating, I don't care how much willpower you've got, you need to eat. And then that's what drives the binging and things as well. Getting a bit off topic, but so management of fatigue is really important as well, especially during menopause and things, because doing a lot of high intensity training and things like that is very fatiguing. You get away with it when you're younger, but the minute you're like overstressed or over fatigued, it's going to spill into all these areas that you're trying to get better, like sleep and stress management and things like that. So during menopause, recovery becomes the most important factor from exercise, making sure you're recovering. So doing three hard weight sessions a week, 3 hard strength sessions a week, lots of walking, lots of yoga, lots of breath work is probably the perfect way to approach your exercise once you're in this age group. So yeah, and focusing and scheduling deload weeks as well. So deload weeks is just really a rest week. Like I've just explained, diet breaks there. A deload week is an exercise version of that, if you like. You'll maybe train hard for 8 to 9 weeks, 8, 9, 10 weeks. And on the 11th week, you'll have a week off, or you'll have an easy week, or you'll have a week of just walking and yoga, and you'll really pull back all the hard stuff. You let your body recharge a bit, maybe bump your calories up on that week, and then go back into it again. So physiological considerations. What happens? So as I said, as estrogen declines, you become insulin resistant. So looking for that on blood tests or starting to test your blood glucose with a finger prick if you actually want to know. But simply by changing your diet and exercise, you will improve your insulin resistance anyway, to be honest. There is supplements you could use, berberine, alpha-lipoic acid, things like that. There are obviously GLP-1s, the weight loss drugs. That is what they're for. They're type 2 diabetes medications. They are for improving insulin sensitivity, and just by default, they affect appetites, so they're spilled into the weight loss world. But they are supposed to be very useful during menopause and be synergistic with some HRT plans. So that's something you could think about as well. But you would need to keep an eye on that. So insulin resistance is one of the sort of health issues that it causes. Thyroid dysfunction as well. Spoke about that at the start. Estrogen is crucial for thyroid health, and if levels drop, thyroid function can slow, lead into symptoms like fatigue, weight gain, and difficulty losing fat. So stress also plays a role in thyroid function, because cortisol, when you're stressed, the release of cortisol can inhibit T4 converting to T3. So your thyroid produces two hormones, T4, and it converts to T3, sorry. But if your cortisol's high, it prevents that conversion. So again, it affects thyroid health. So regular thyroid testing as well on your bloods. Keep an eye on your thyroid health. But nutrients to include, and you could supplement these, are selenium, zinc, and iodine. Nobody gets enough iodine in their diet. We get it for seaweed, and nobody eats seaweed. So you could buy kelp from a health shop or something, and that'll give you your iodine. So menopause and heart disease. This is how I said at the start. This type of stuff could only be prevented with good nutrition, or managed with good nutrition and exercise. Even in younger people and healthy individuals, you still need to do this stuff. So women in general are at lower risk of developing cardiovascular disease than men until menopause, and it's because all of the hormone changes that I've mentioned. So during menopause, your risk actually comes up, and it's about the same as men from there on, your risk of developing cardiovascular disease. Because of insulin resistance, the abdominal fat accumulation, the differences in the fat distribution that I mentioned, and also increased cholesterol levels and a change in your endothelial dysfunction, which is a change in your endothelial cells that line your blood vessels, which is related to elevated blood pressure and things like that as well. So all these metabolic markers are linked to each other, and all of them together, the cluster of them is called metabolic syndrome, and that can directly cause cardiovascular disease. And it's almost like by default, when women go into menopause, they almost develop symptoms of metabolic syndrome, the insulin resistance, possible high blood pressure, and abdominal fat accumulation. Like this all seems to develop by default, just by your hormones dropping and things. So HRT is really important. Like, you can't replace HRT with nutrition, but nutrition and exercise will amplify the effects of everything, whether you're healthy or menopausal or pre-diabetic or anything. This stuff is really important, and it goes way beyond a calorie deficit. And yeah, so progesterone therapy as well. Again, you would take a consult with your doctor, but progesterone can help regulate cortisol, so reduce stress and improve GABA function, which would aid sleep, reduce anxiety, and it's a great tool for struggling with mood swings, etc. So, in conclusion, I hope that wasn't too long, but I just try to run you through the possible health implications and how you can deal with them through proper exercise, proper nutrition, and I've also written that case study as well. I'm going to pop this on my social media. If anybody wants a copy of this recording, just DM me and I'll send you over a case study as well. The case study is more like how I would approach nutrition with a client, I didn't really touch on that here. It was just the science behind stuff. So thank you very much if you've made it this far, and I will speak soon. Cheers, guys.